Good afternoon. My name is Laura Maria Caldarone, and with us we have Vicky van der Togt from the Netherlands. I am in Germany, and today we're going to talk to the founder of Zero COVID Alliance, Vicky, and we're going to talk about this new series that we are doing on long COVID. And the name of the series is The Long Haul. So, first of all, Vicky, hi, how are you doing?
At the moment, I'm doing well, better than over the last couple of months, actually. So yeah, things are looking up.
That's uh, that's how it is, right? In this pandemic, there's been times that it there seems like there's no end, but then good news come and we have more hope. Not only I'm talking globally, right? Because as I said, you're in the Netherlands, I am in Germany, and right now we just said hello to April. It's the second year of the pandemic. And a lot of countries in Europe are doing quite similarly. Some of it is good because we do have good news, right? We have a vaccine. Last year we didn't have a vaccine, but at the same time there are things that I don't know, they're putting us down. But let's start with you, first of all. As I said, this is a series that we're doing for long COVID. And you are not only the founder of Zero COVID Alliance, which I obviously we're going to talk about that, but you are also someone that has long COVID. So
Yes.
we're going to talk about so many things. And I would like to start with that. Just tell us about yourself. Tell us how and why you created Zero COVID Alliance. And let's talk also about your journey with long COVID.
Yes, let's. Yeah, so 1 year ago, or a little over a year ago now, in the beginning of March, I got sick with COVID. And I really got infected even before the first patient was confirmed in the Netherlands. So it was a really strange time. There wasn't much info on what COVID was, who it affected, what the severity of disease was in different age groups. And basically in the Netherlands, our government has came out with statements saying that it mostly hit the elderly. But because I got ill so early on, really before the first wave hit, before the peak of the first wave, I should say, I already knew that what was communicated by the government, which was that it only mostly older people got severely ill or died from it. Um, because I was so ill myself, I knew that wasn't true. I am only 20, well, I was 28 back then, I'm 29 now. And really, I've been so sick in the first couple of months. I got all the symptoms that we now know about. I've had a fever for three to 4 weeks, on and off, really bad fever as well. Double pneumonia in both my lungs. I was so tired that I was sleeping, I feel like 15 or 16 hours a day, and then still I woke up and was exhausted, but not just exhausted as if in you when you go to bed late one day and then you're just a little tired. No, exhausted in such a way that it even felt like too much to get up and make food or to get up to go to the toilet. Like even that was too much. Um,
So the
and
little everyday things that you do automatically without thinking.
yeah, exactly. And it's, a lot of people say that the initial phase is the worst, and but it only lasts like for 2 weeks or so. Well, it didn't. The initial phase for me lasted about 2 to 3 months. And that was mostly because the pneumonia and also the circulation issues that I got with COVID, because my saturation dropped to about 83 and on and up. It was really fluctuating for a long time. And I developed all kinds of circulation issues, mostly in my legs. That I didn't have any strength in my legs. I had a lot of inflammation throughout my body, really. So in my wrists, it felt like my brain was on fire for a long time. And because of all the inflammation and the pneumonia at the same time, it was basically impossible to walk because it felt with every step that it was, there was something like rubbing against my lungs on the inside. And it was just so painful. And aside from that, that's a lesser known symptom, but I had a severe rash over my whole body. So I thought at the beginning that it was shingles because I had shingles over 10 years ago, and it looked the same and it felt the same. But it started as shingles, but it turned into a different type of rash. So I had all different kinds of spots on my body, and that caused like one day it would just itch, and then the next day it would burn, and that could even during the even during one day it could really change like the how it felt. So I had nights when then at like 8 o'clock it would start itching, and then at 9 o'clock I would have like an open spot on my skin, and then like I wake up the next day and it's gone. It was so strange, but because I had that all over my upper body, both on my stomach and on my back, it was impossible to basically stand and walk, like I said, but also to just sit down or to lay down because everything was painful.
And I mean, we need to remember one thing, because it's been a hell of a year, pun intended, because there's been so many things going on every day in each of our countries, but globally, right? News wise, and just events, things happening with the coronavirus pandemic. So we need to remember that we're talking about March 2020. And in March 2020, it was very difficult to get tested. So you are part of the group that was not able to get easily tested. And then you mentioned that the government in the Netherlands had said at the beginning that it was a disease that affected the elderly. We had the same thing here in Germany and in other places of Europe and in the world, saying, yes, it's something strange. It's a virus that affects the elderly or people with pre-existing conditions. So you had young people, your age, younger, a little bit older, that weren't as worried, weren't as careful. And so you're the first wave of long COVID, because right now you're describing your symptoms when you had COVID-19.
Yes, exactly. Which is a way different than the symptoms from long COVID.
And it didn't stop there. That's the thing. You didn't recover. So you weren't even a number for the government, because you weren't a statistic, a COVID-19 statistic.
No, not at all. Yeah, even worse, actually. In all the statistics that are being presented by RIVM, which is the Dutch CDC, they use this pyramid with all the people that get infected. So they say of all the people infected, around 2 to 4% get admitted to the hospital or die. And then the rest of it, there's this middle bit that only get mild symptoms and stay at home. And then there's people without symptoms. There's nothing in between for them. And there hasn't been anything in between for them up until last week when they acknowledged long COVID.
Oh, okay. So we'll have to talk about that, because
we'll get to that.
Obviously, as this is an episode about why we're doing this series, how Zero COVID Alliance was founded, and also your journey as a long COVID patient. Obviously, I want to know also, because you live in the Netherlands, what was the journey of the Netherlands with their pandemic response? Tell us a little bit about that, so we see how a country here in Europe reacted to it, but also with long COVID, right? So going back to what you were saying all those symptoms were COVID-19. And then,
And then, well, like you say, getting tested was almost impossible. And because, of course, like I got sick and then the first wave came. So it was also kind of impossible to see a GP or to get to a hospital if it was necessary. So in the first couple of weeks, I was in frequent contact with my GP, but I was not allowed to come by because, well, if you have symptoms, you're not allowed to go into the office. Well, of course, I know that, and that wasn't the idea behind me calling them, but just I had to know what to do. Like if I needed care, and like, are there any medicines that can help me? Is there anything they could do for me? Well,
information.
basically, I called a lot of times. Well, it wasn't possible to get tested because back then they only tested healthcare workers or people with essential jobs, which I didn't have. And Yeah, so for me, all the calls to the GP couldn't really do anything for me because they couldn't see me. So they set up this WhatsApp chat in which I had to take photos of the rash that I had. Basically, I got a diagnosis through WhatsApp for the rash, and the diagnosis was wrong because they put me on antibiotics that should only be given to people with a bacterial infection and not with a viral infection. So that backfired and actually made things worse. And it went on for 2.5 months with them basically sending me medicine with the hopes that it would do something. Uh, but aside from that, I really love science. I always have, and so I read studies just for fun. So when COVID came along, I was reading everything there is to know about it. And so I already had some sense of what the different types of symptoms were. And one of the things that I, of course, Googled when I got a rash myself was, is this something that is a symptom for COVID? And that was confirmed already back then. So in March 2020. But my GP didn't know anything about that because it wasn't listed by REVM as a symptom. And so I actually had to send these studies and alert my GP to the existence of these studies, simply so they could help me. So it was really like the other way around in terms of getting care. It was me telling them like, look, this is going on, instead of them being able to do like a full checkup and to see what was wrong with me. So it was a really strange time, and luckily eventually after 3 months the rash got a little less, although I must say it's still there, it's on and off.
Still there, as in still now, April 2021, you still have bouts
Yes.
of it.
So yes, I still have a rash to this day. It still comes and goes.
So this is, wow, this is a year. So it's been a year that you had COVID-19 and now you have long COVID, which some of the symptoms that you had from the very beginning, you still have them now. On that note, I'd like to backtrack a little bit. And before we continue talking, before you tell us how and why you founded the Zero COVID Alliance and what type of organization it is, you tell us what type of organization it is. Just as from your perspective of, in simple words, how can you describe, what would you say long COVID is?
Oh, what long COVID is. It's the persistent symptoms after the initial disease. I mean, some people clear the disease in a couple of weeks. Their immune system is able to produce enough antibodies that eventually get rid of the disease altogether, and they go back to normal. But for some people, it's not that simple. And what the reason for that is, we still don't know. But yeah, for some people, these symptoms persist. For some, they get better over time. So in weeks, for some, it takes months. But there's also a large group of people that still have symptoms to this day. And for them, it really looks like this could be chronic. And these symptoms, I mean, you have to know the list of long COVID symptoms is a really long one because COVID really seems to affect all parts of the body. So there are people with persistent lung issues. So some have scarring because of the initial disease. Some have palpitations. There's extreme fatigue. That is something that almost all patients report. A lot of people are experiencing inflammation throughout the body. Oh, what else? Yeah, there's just so much. I mean, the original list is about 200 symptoms. But for me, one of the most difficult symptoms to deal with are the neurological symptoms. So that doesn't mean anything psychological for me. It's neurological in the sense that, for example, memory loss. Memory loss. I've never had any issues with my memory. I mean,
Is
I'm only
this, I mean,
29.
yeah, you're young, but when you say
Right.
memory lost, you mean short-term memory, new memories, or long-term, though, like old memories of something that happened?
Both,
Both.
both. And one of the ways that I found out about that is when I was having conversations with people and I just couldn't find the words. That's how it all started, and that got worse and worse. And really throughout time, there's been different situations where it was really clear that my memory wasn't what it was like before. So I've had like full blackouts where people ask me, "Oh, so where do you live?" And I didn't know. I didn't know where I live. I didn't know what my house looked like, even while spending a year inside.
I mean, yeah,
And yeah, it's been crazy. It's been a crazy thing to deal with. And honestly, I've heard someone describe it as waking up in a slightly dumber body. And I know dumb wouldn't be the way to describe it, but yeah, it kind of feels that way. Um,
I guess even sluggish, right? That you are not at the speed as the world is
mm,
going. Like there's, that's how that's how it sounds, because you mentioned earlier when you were describing your symptoms with COVID-19, you were saying everyday things, like getting up or walking, or automatic things that you do without thinking with your eyes closed would be difficult.
mhm,
And then now
exactly.
with long COVID, what you're describing of somebody asking you, where do you live? And not being able to describe your apartment or give the address of your place. That
Yeah,
that's
well, if it were just the address, I could live with that. I mean,
yeah,
people
that's
are
okay.
searching
But
for things like that more often. I mean, I guess that comes with age. Well, maybe not with 29,
not with
but in this case, the thing that was so scary to me was that I couldn't picture it. I just couldn't picture it. And then she asked me, like, do you have a balcony? And I'm like, I have no idea. It took me a full 2 minutes to actually get a visual of what my own house looked like.
and let's not forget, I mean, this is very obvious, but who knows, in a few months, in a couple of years, whoever and whenever people re-see these videos, keep in mind that it is a house that she, just like most of the world, has been in 24/7, because we've been in lockdowns, we've been in quarantines, we've been doing home office. So if there's one time that you should know every detail of your house, is now. And
I can make a joke out of it saying, well, I really want to forget about my house after being locked up for so long. But yeah, that was not
yeah,
what was going on here.
no, it's wow. And that adds to the stress, right? Because
Yeah.
obviously we're talking now about long COVID, and we're doing this series for Zero COVID Alliance, and there are more and more organizations that are taking interest and working with long COVID patients, and just with the research and acknowledging, right? But this was not the reality from the very beginning. And this for many months, it was very quiet. Only around the summer things picked up. And let's not forget the name long COVID has actually a nice story behind it, right? Because some people like you knew that COVID-19 didn't just end at a certain point in time, but it continued, but there was no name to it, right? It was just what goes after. And the actual word long COVID is actually a patient created term, which
Yes.
was first used, which is describes perfectly this whole pandemic on Twitter by a hashtag by someone that had long COVID, Dr. Eliza Perego. She's the one that coined it, right?
Yes, exactly. And if I'm correct, was this in July?
May. So it was in May 2020 that she first used that name, and then it took a life of its own. And it's the patients, right? Because like you said,
Mhm.
your general practitioner was not understanding, was kind of ignoring. You had to come with information. And that has been one of the problems with long COVID patients, that they weren't being heard. So you were
Exactly.
sick and you were the one bringing information and saying, listen to me.
Hmm. Yeah, so myself, I mentioned I couldn't get tested. Well, eventually I could get tested in June, but of course, like if you cannot test positive 3 months later, like that's impossible. But how GPs use that is like, well, you test negative, so there's nothing wrong with you. It's not COVID. But like Elisa, I was having long-term symptoms, and I've been reaching out since June to so many healthcare organizations in the Netherlands. So I've been talking to the Lung Fund, to the Heart Foundation, to my own GP office, to different types of hospitals, to just kind of see like how much they knew about this. And the answer was nothing, really nothing. And eventually, I had a very long conversation in the beginning of July with a Dutch epidemiologist. And he was actually the first person who was interested. He saw I post a little bit of my personal experience on Twitter, and he saw that and reached out to me. Because he had been working with different types of viral diseases before, and he knew about post-viral disease. He'd seen it before. He'd helped a lot of patients, for example, with Q fever in the Netherlands years ago. And yeah, that was a 2 hour long conversation. And to me, that changed everything, um, because it was the first person who was willing to listen. And the first time it was taken seriously after like being ignored and gaslit by the whole healthcare system for, yeah, almost 4 months. So yeah, that's it's crazy to think back to those days, knowing what I know now and how many people it affects. But yeah, it was a slow start.
It was a slow start. It did take a momentum. So through social media and through studies and through different health organizations that started talking about it and paying attention around the summer and even after the summer of 2020. And but I'm thinking, just like, correct me if I'm wrong, but the way I see it is just as your ups and downs that you are having with long COVID itself, that's how the acknowledgement, the recognition, and the interest with long COVID has been. You have weeks and months that maybe there are a lot of articles and interviews and people talking about it and saying, hey, it's not only about getting or not getting COVID-19, it's also
Mhm.
about making sure of not getting long COVID. And you have moments of silence, of as if it's been forgotten. Is that
Exactly. And that's, I think that's only normal as well in the beginning, at least, because of course, like all of this started after the first wave because there was a huge influx of patients with long-term symptoms. But then infection or cases went down, and they stayed that way throughout summer in most countries. And so there weren't any new long COVID patients back then. It seemed to be going all right. A lot of people were almost celebrating, like, oh, the pandemic is over.
yeah?
And then of course, like there was the second wave, and we knew that there would be another influx of patients in all the support groups, and yeah, that's exactly what happened. And now after the third wave, or
Yep.
during the third wave I should say, I mean, now we know the numbers of long COVID patients in terms of the percentage of all cases that go on to develop long-term symptoms. And ever since we had these numbers, it's been frightening to do the daily math, right? To see the new cases, and you can just see how many of those people. So in the Netherlands, for example, last week we had around 7,000 cases. So you can just see that every day there will be 1,400 patients that will have symptoms for at least 5 weeks. And you'll have around 700 patients that will stay sick for months, if not for years. And that's scary. It's a scary thought.
And it's
It
sad.
shouldn't be that way. It's sad. Yeah.
It shouldn't be
It's
that way.
preventable.
It's preventable, and it's just like, it is true that we have had an overdose with data and numbers, and every day, wherever you are in the world, your government says, yes, today there are this amount of new cases and there are this amount of new deaths, and some countries say how many have recovered. But the thing is, from the beginning of the pandemic, the recovered there, the numbers are actually not correct, right? Because you
Oh,
you said your experience is different from other people's experience with long COVID, because there are people that were asymptomatic, so they had COVID-19, they barely had a sore throat, they were fine, so very mild course, and then weeks later or months later, they're not okay.
exactly. And we hear this more often in kids. That's something I should just mention. And aside from that, yeah, we now know that even asymptomatic people can get, for example, myocarditis, so inflammation of the heart muscle. And yeah, like that can have serious consequences. Like if you don't know about that and you go back to normal life, or you'll do like rigorous exercise, that will play up, and that can have serious consequences. I mean, we've seen specifically athletes that had COVID that went back to work, so back to their sports, and then just dropped down. And it turned out that they were suffering from myocarditis. They didn't notice it before, but once they got back to the level that they were at before COVID, then they figured out that they were not okay. And I'm just wondering, because like you say, like the numbers of recovered patients, they're incorrect. And that is purely because most countries don't monitor patients. Actually, in the UK, it's one of the few countries that actually monitors patients. So they have an app in which people can fill in their symptoms every day. And so we get a sense from that, how many of all cases still have symptoms, ongoing symptoms. Um, but yeah, it's the only country we get some data from that's reliable. And honestly, we should get this data from every country, just to see if there are any differences, also in initial treatment, if there's we can get some clue out of that, like what type of initial treatment or medicine could help prevent or lower the numbers of long COVID. And this monitoring, because a lot of countries don't do it, they just report that once people are out of the hospital, they're recovered, right? Um,
Or
but they
even
don't say
people
that.
or even people that were tested and positive, and they had a mild course or an okay course and were at home, and they never went to the hospital, then they're considered after 2 weeks or so, depending on the country, recovered. But you don't
Exactly.
know what happened after
Mm.
or during or anything. And even in the case of the UK, that has been one of the best countries in monitoring just symptoms and what's happening after a certain period of time. So we have a better idea with long COVID. Even then, we need to remember that in the grand scheme of things, you are relatively lucky with your long COVID. You are able to, for instance, right now, have a conversation with me and be okay and work and have your organization and so on. But you have
Mhm.
people of different ages, different realities that they can't even do that. So, how can you expect them to every day log into an app and describe their feeling and describe their symptoms when they can't even, I don't know, sleep or cook something to eat or anything? So
Yeah,
even that data, it's not 100% reliable because you have people that just stop reporting their symptoms, not because they're recovered, but just because they can't deal with it, for instance, anymore.
exactly. And therefore, it is really important that there are studies set up to actually follow patients for a long amount of time, at least a year, to just see what COVID does, like what changes their bodies go through, um, what type of possible cardiovascular damage they see over time if it repairs itself, what type of neurological damage that they can find. I mean, there's so much to uncover here in terms of figuring out where different symptoms come from. Because, like you said, they're not all the same. There are so many different symptoms, and they're not all caused by the same thing. So, for example, if people have lung issues, that could be because of the initial infection. It could also be triggered by something entirely different. So, for example, in my case, I have heart issues and I've been having them since the third month of getting infected, so not since the initial phase. Um, and that really persisted, but it changed over time too. But I know also, like, I know a lot of long COVID patients who don't have any heart issues. So it's not to say that that you just take a group of patients and you look for every single symptom. No, it should be divided. We should look for the cause of every single symptom. Um, because yeah, the initial disease, it goes through your whole body, and therefore we should look at every single part of the body and every single mechanism that could be driving these symptoms.
I mean, that's what it is, right? With this pandemic, that's how I have been taking care of myself. I've been very strict with what I should do in order not to get infected. Like I
Mhm.
knock on wood, I haven't had COVID. And one of the big reasons that made sense to me from the very beginning was because it is a novel virus. It's a new virus
Mhm.
that how am I supposed to know what it's going to do or not do? And if it has affected people that are healthier than I am, that are younger than I am,
Mhm.
what who can assure me that it won't happen to me, that if I get sick,
Exactly.
i'll barely I'll barely have any symptoms and then I'll be fine? And even if that's the case, who can assure me that I will not have long COVID? Because right now we call it long because it's longer than the 2 weeks or a couple of weeks of COVID-19, right? But it's only been a year. So we know people like you and like many others have it for a year, which is a long time to be sick of something that you don't know. But we don't know what's going to happen in 5 years and 10 years. We hope
Exactly.
that things will be better sooner rather than later. But hoping is great, but you need to be realistic about it and work
Mhm.
towards that, right? And
Yeah, and like one of the fears that a lot of doctors have expressed is, for example, one of the things that people have been reporting is early onset Parkinson's after COVID, um, dementia after COVID. And of course, um, if someone 60 plus maybe gets COVID and they report dementia, well, maybe it speeded up the process. But what's to say what will happen to people, for example, if kids get it? does this affect them in the same way? Will this eventually cause a wave of diseases such as those? It may well be that way.
And that
So we have to do all this research, and not just because, like, we've seen over the last year that there's been a lot of research being done into the initial phase, because of course, like, we're trying to save people. So everything that we can figure out about how to save people from dying in the initial phase of COVID, that's great. Of course, we should do that.
yeah.
But there's also the quality of life to look into, um, because that's a thing that's not looked at enough. I mean, my life now is only a fraction of what my life used to be a little over a year ago. And that's huge. That's huge for so many patients. It's a complete 180 of how I'm living my life, how I see
Yeah.
my future. And that's for me as at least an adult, at least like a 29-year-old. But I'm really curious to see what this will do to kids that got infected at a young age.
And like you said, when one is 30, that is young. That's when life starts, right? I mean, depending on what year we're in, it's always like your good years start when you're 30, when you're 40, when you're 50. And I think all of them are right, because as you mature, you understand what's important, right? And you are approaching your 30s in a different way, knowing what's important and not having some of those things. I don't know how comfortable you feel, like maybe giving us a couple of examples of what you mean of how your life has changed, like how things that you would have been able to do or you were able to do a year or more ago, and now you can't even think of it.
Well, yeah, one of the things that bugs me the most is because of the brain fog, I've been having a lot of issues with reading and writing. Um, but my job before I started doing all of this was that I ran a platform for sustainable living, and so I was used to reading through these year reports of organizations that try to make steps towards a more sustainable supply chain. And I love doing that. And I what I used to do is write analyses about these reports. But now, like, I often have to use a text to speech program to just be able to write or to read long bits of text. The writing part, I still have so many issues with that sometimes, even like sending out a simple tweet, I can actually spend over an hour on a tweet, and we all know that it's, what is it, max 140 characters. It can never be that long, and it shouldn't take this long. And no, that's one thing. And for me, like, um, I've worked from the brain. You know, you can work with your hands or you can work with your brain. But in this case, having this brain fog, it changes everything for my future. It means a change in career, or even the hopes I have for my career. Um, so that's one thing. Another thing is that I always used to do everything by foot. I mean, I live in Voorburg next to The Hague. I was always going into the city, going on these very long walks. I used to walk for at least an hour a day, and usually about two or three. Just going into the woods, walking to the beach even, which is not that close by. And now, like, I didn't even mention it before, but post exertion malaise, they call it. So basically getting really tired and possibly relapsing after doing any physical activity. Yeah, that makes for a situation where that cannot go on long walks. Things like hiking, I used to love to hike. And going on holidays to me would actually mean that I would go hiking for maybe like 8 hours or 10 hours a day. I know that's not a possibility now. for months on end, I wasn't even able to get out of my own street because that was already too much. Going, taking the stairs was already too much. I had to stop halfway, catch my breath. And after even after going for like a 10-minute walk, I had to sleep for 4 hours just to recover from that. Now, luckily, it's getting a little bit better, but still, like after going for now it's a 20-minute walk, yeah, I'm dead tired, and that's not normal for someone my age, and that means that I have to change the way that I live, like rigorously. It's so many small change because, like, if you look at the list, it seems, well, all these symptoms easy to deal with, and they would be if it was just one of these
One or
symptoms,
a couple,
just
but not
two.
so many that
But
change.
that's the thing. I feel like a lot of people, they look at this list and they think that most patients only have one or two of those, while in reality most patients have most of those, and that's what makes it difficult, um, and also difficult for people to understand the disease.
Yeah.
So yeah, for me, it means so many changes to my life. It means always taking long COVID into account with everything I do and everything I plan. Even talking to you right now, I mean, I have to think beforehand, like I'm going to have to speak. I have to take some time to get calm to make sure that the brain fog doesn't play up, because if I'm thinking about too many things at once, like it will become one big mess in my head, and I will not be able to find words. I have to sleep properly beforehand, like, and I cannot be talking to you for more than, let's say, 1.5 hours, because I will be like mumbling, and you wouldn't be able to make sense of what I'm saying. So yeah, lots of small changes that add up to a full life change.
And you don't know when it's going to end. I mean, that's one of the worst things for anybody that has something that it's not clarified and clear for anything. Because you just said the symptoms, right? Maybe having fatigue, or maybe having one or two, three things. One could think, okay, it's okay. But having most of those symptoms or all of those symptoms, and they're not even organized, right? It's not even like, okay, I know that for a month I'm going to have these three symptoms and then these, so then you can also navigate, right? No, you can have one day with nothing and then a whole week with most of them.
Mm-hmm.
And it just makes, I don't know, the way you described everything, it just makes me think, imagine having to change even your dreams change, your goals, because now you can't think, oh, okay, when the pandemic is over, I one of my first things is I want to take a trip to XYZ place. How do you know if you can get into a plane when planes are back to norm? How do you know that taking an 8-hour flight is something that you can do if
Exactly, because I've been dreaming to go to Greece after this pandemic, but I've been taking a lot of trips to Greece, and I always used to go hiking. I used to go into the mountains. Well, that's not going to happen. Am I able to swim? Will the cold water have any effect on my heart? Like, these are all questions that go through my mind now when I think about that. So
well, it's and the main thing is going back to data, because I think although we've had an overdose of data, it's very important to understand that whenever you hear that your country is having, for instance, here in Germany, we're not doing very well. Europe in general is not doing very well. It is true that we have vaccines. That is incredible, because to have used the technology and the knowledge of the past in order to all the doctors and to just work on a vaccine so fast is incredible.
It
But
really is.
having a vaccine is not enough, right? You need to produce it, you need to distribute it, and you need to like make sure people understand and take it and want to take it, right? And
Exactly. Be informed, and then all the vaccines have to be administered, and it turns out
administered
that's
exactly.
the
And
biggest deal.
we're not, that's not what's happening. So the rollout is very slow in Europe right now. Less than, in the European Union, less than 14% of the population has had the first doses. And this has been what, we're in month 4. Some countries started in December for certain categories. It's going very slow with the new variants, which are meaner, nastier, worse than the normal old COVID, making things more difficult. So yes, you have good news with the vaccine, but you have things that are not going that great. And so when we hear these numbers of, for instance, in Germany, we've been having 10 to 12 to 14 to 15,000 new cases per day. You need to
Yes.
think, first of all, each number is a person, right? With family, with goals, with memories, with futures. And from that number, it is a certainty that some of them will die, because the more cases you have, the more hospitalizations you will have, the more deaths you will have, and the more long COVID you will have, because it's not you get it and either you recover and you die, which dying is, I mean, you can't get worse than that. But then it's, do you recover? Do you die? Or do you get long COVID? And
Yeah, and I'd love to add another category here because people also die from long COVID. And that's one thing that people seem to forget about a lot. But I've had people that I connected with in the Dutch support group who eventually died, but months later, some even like 8 months later.
that's,
So that's happening as well, and there's not nearly enough coverage of that.
I mean, there's not enough coverage on long COVID. So how can we expect there to be on deaths of long COVID, right? And that is why we're doing this series. So that's, we'll talk about the series and the format in a little bit. I'd like, we spoke already about your journey. We spoke a lot on what long COVID is, right? Can you just tell us about, because you are in the Netherlands, just how has the Dutch response been with long COVID?
Well, like I mentioned before, it was a very slow start, slower than in most countries. So by the time that I realized that my symptoms weren't going away, which was basically in June, June, July, um, nobody was talking about it. Nobody. And so eventually there was a Facebook group that started, a support group. But and of course, like it's great that there's a support group, but that's that doesn't mean there's actual treatment or acknowledgement. And so the support group managed to reach out to the media, and so there were some articles that came out, but maybe like once a week. Um, and like of course the government wasn't acknowledging it at all, like it just wasn't mentioned. um, and that stayed that way for a long time. I think the first time it was mentioned in our government was somewhere around December, but that was only one politician and nothing came from it. And then it took another couple of months. I think it was in the beginning of February that another politician came out with questions about long COVID, specifically in regards to the new strategy going forward. Because
How
she,
that is part of the strategy, right? Because that's one of
yeah,
the things when all these countries are easing restrictions or thinking about their strategy. how is long COVID part of it, right?
Right, because in the Netherlands, they've always said that as long as the ICUs are not overflowing, then all is well. They have a strategy that is based on hospital capacity. And so when these people, long COVID patients, don't end up in the hospitals, they don't matter for the strategy. Well, in reality, if you know that there's a disease that causes long-term symptoms, if not chronic, for 10% of all the people that get sick now, that doesn't just have consequences on short term, it could have serious economic consequences for the long term because these people are not able to go back to work.
Yeah.
And I know that that's not the perfect way of looking at it because I'd like to put health at the forefront. But in terms of how a government looks at it, that should be really important to them. But it hasn't been for a long time. And actually, it took until last week for long COVID to actually get acknowledged by the REBM. And
Wow.
what that means now going forward, honestly, I don't know yet because we don't have a change of strategy to go along with this acknowledgement. As is kind of the same in the UK because over there it was acknowledged earlier on, but it also didn't actually affect the chosen strategy.
Didn't influence as much as it should
No,
have the
no,
chosen
no,
strategy. Yeah.
yeah. It was like one tiny paragraph there, and it's not even mentioned in the Netherlands. So yeah, it's actually it's one of the reasons for me to get into action because I saw that there was such a need for awareness on the topic. Um, so I'll explain a little bit about that because I have become very active.
Yeah.
And so in the Netherlands, from March on out, there were a couple of people who organized themselves into a group, a grassroots movement called Containment Nu, which the name kind of speaks for itself, but they were in favor of a containment strategy. They built their website. They basically wrote the way to eliminate a virus, which in all honesty is not that hard to do because there's a pandemic preparedness plan for most countries. So basically what we've been asking for, or what they've been asking for since March, was basically to follow the plan that was already there, to follow the law that there is for dealing with infectious diseases of this kind. And so when I eventually felt a little bit better, which is at the end of June, I really came out of that like initial disease phase and I was able to do a little bit more. So I reached out to them and said, well, you are really covering the the government's response and you're focusing on certain topics, but I feel like you're really missing one topic, and that is long COVID. So I'd really like to join and give that perspective. So from July on out, I've been part of Containment Nu, and we've been advocating for a change of strategy for over a year now as a group. And we've done so many different things in the Netherlands. I mean, we basically kept track of all the statements that were done by the government, RIVM, by different members of the outbreak management team, and basically went to fact-checking mode. Because there were so many things that were stated in the papers that just weren't true, such as about masks, about COVID being airborne, about schools, because they said for a long time that schools do not play a part in this pandemic. And we know, of course, that that's ridiculous. It's such a strange assumption that a kid is different from an adult.
Yeah.
Like kids spread all diseases. Every parent knows that. So it's really odd to kind of think that that would be different for this particular disease. So yeah, we've been advocating with Containment Nu. We've been doing that online and offline. We reached out to many different organizations, both healthcare organizations, human rights organizations. We've been reaching out to politicians, both national and regional, and we've managed to get some information across. I mean, we helped, for example, setting up an outreach campaign in some small towns to reach specific age groups with their they wanted to do this offline campaign with postcards where they were trying to convince young people, like, please stick to the rules. If not for yourself, do it for someone else. So we helped design that and come up with slogans, and that is just one of the small things that we have been doing. We had some demonstrations, also a demonstration in Amsterdam where a member of the political party Bijeen also spoke, which is the only party who has been in favor of a zero COVID strategy from the start. So they were really happy to work with us, and they've been also speaking up for people in high-risk groups. Aside from that, we held a wake in Amsterdam, so a candle vigil, because really, like, so many people died from this disease, and there was no acknowledgement of that. There was no memorial, no
Moments of silence or
nothing. And just losing someone in this pandemic, being locked up in your house, not being able to hug your loved ones or to have that moment, even some
that
people
goodbye.
not being able to go to a funeral, that is heartbreaking. And you need something like a funeral or a wake, something along those lines to get through that grieving process, or to get to that grieving process. So we really wanted to help people do that. And so we held a wake in Amsterdam where we wanted to light at least 10,000 candles, one for each COVID death. And it was a beautiful night. We held a moment of silence. There were some people that brought photos of their loved ones that they lost to COVID along with them. So for a long time in the Netherlands, we had been really active and really spreading awareness about how damaging this strategy was, both for the people that caught the disease as for people in higher risk groups. But we didn't get much traction nationally. And by then we were at this for a couple of months, and we've seen the same thing happening in the UK. Of course, Boris Johnson also stated that they were going to go for herd immunity, and the situation was somewhat similar. And we had also been in contact with a group from Sweden. I don't think I have to explain much about Sweden, but yeah, it hasn't been pretty. The chosen strategy is horrible.
And let's not forget, now that you just mentioned Sweden and how horrible the strategy is, it's not only horrible for Sweden, because unfortunately it has been used throughout the pandemic as the poster child of how to handle the pandemic. And no, their strategy was herd immunity by infection, meaning you ignore long COVID, you ignore how it affects young and old. And we are seeing right now, actually, in April 2021, how that strategy, it just brings more deaths, more suffering, and more long COVID, and just more of the bad things of this pandemic. Look at Brazil.
Right, and we see now how all of that played out. Sweden has huge numbers of long COVID patients, and also long COVID in kids, because they kept the schools open without measures, without any proper measures. And so that has been a really really scary situation, really dangerous situation for both the kids, their parents, their grandparents, and the teachers. Because, mind you, in Sweden, teachers for a long time have been, they weren't allowed to wear a mask. That's insane. But because we were in contact with the UK and with Sweden, and we saw that they too had been advocating for a long time but didn't get much traction within their own country, we really felt that there was a need to amplify our voices internationally. And so I decided to look around to see if there was any organization that did that. And I ended up with endcoronavirus.org, which is a worldwide organization, a volunteer network, all based on COVID response. So there are over 6,000 volunteers on the network. And basically, they all advocate for a zero COVID strategy. Um, but in terms of the groups that
Sorry to interrupt you, but I think it's the perfect moment to just give us a little bit more on what is a zero COVID strategy. We spoke a little bit, so it's clear, but as you know, there are still a lot of countries that are not aware or don't know the details, and there's a lot of misunderstandings also. So what exactly is a zero COVID strategy?
well, great question. I mean, a zero COVID strategy, it basically comes down to aiming for elimination, as we should do with a disease of this severity. It means that you do everything in your power to bring cases down to a situation where you can trace every single infection and break the chain of transmission. Um, that's the only way to stop this disease. So that also means that with the contact tracing, you do have to actually quarantine everyone around an infected person, because that's the only way you stop the spread. And all of this is logical, right? None of this is actually like a crazy thing to ask.
It's
Um,
things that we've known not only from the past, as in before the pandemic, but also looking at other countries such as Australia, New Zealand, but also Vietnam, China, South Korea. And it's what you said, bring the infections numbers down and then keep them down, because
exactly.
that's what allows you to basically do a lot of the things that we no longer do. I mean, you've seen videos right now of events in Australia and New Zealand and Vietnam, of concerts, of what normality was for us before the pandemic, right?
Yeah, and it looks pretty great, huh?
Yeah,
And
and they're all like really close to each other, and there's no masks, and they're singing and talking, and obviously the reason I say singing and talking, because it's one way to really infect somebody else, right? You
mhm,
have the faces, but they don't have that problem, because they have ensured that community transmission is non-existent or very, very low. And then, like you said, contact tracing, testing, you break the chain of infection.
exactly. And like you said, all these countries, I mean, in Europe, when talking about a zero COVID strategy, a lot of people come out and say, "Oh, that's just not possible." I mean, how could we do that? We have open borders. We're not an island. There's actually a lot of countries that are not islands who have managed to contain this virus. It's not about being an island or not. It's about actually wanting to contain this virus, actually aiming for it. Because like there has never been an aim to actually bring these cases down and try to eliminate it. If we would only try, I'm pretty sure we can deal with any of the issues that may come up. Um, but at
And
least try, right?
exactly, try that's the operative word, because all the countries that have tried for a zero COVID strategy, they have made it. All the
Exactly.
countries that have not tried don't have it. And you mentioned, you spoke about governments, and that's the thing. Earlier we were talking about the Swiss cheese, right? Of how to stop the spread and everything. And it was created by Dr. McKay. And Dr. McKay, in his picture of you have little rats of misinformation, we call them, and then you have the slices of cheese. And there it's very clear that one part is what you and I should do. So citizens, the just everyday people, what they should do. But there's another part that is, it needs to come from the governments. So contact tracing, and testing and ramping up and ensuring that it's available and so on. And that's what the zero COVID strategy is, putting all these different uh, epidemic control measures together to ensure we can have concerts and we can just go out and not worry and have a party and just go to school and all the normal things.
Exactly. And all of this sounds so logical. And that's why we've been so vocal about a change of strategy. I mean, we've done this in the Netherlands, and like I said, we really felt like we needed the support from the international community, all the people internationally who were also in favor of another strategy. So we connected to them. We connected to more people through the End Coronavirus network. But I really felt that we should show a united front for all the groups that are already there to amplify their messages, to amplify what is going on in their countries. Because throughout this pandemic, it's been really difficult for journalists to actually get a sense of what is going on in each country, because there's the information by the government, and then there's what's actually going on. And to have boots on the ground in all of these countries, it is of vital importance to separate truth from fiction. So going back to the the international aspect of it all, yes, that's when we decided, or when I decided, that there should be a platform for it. So I decided to start the Zero COVID Alliance. And at first, we were just with three groups. We were with Containment New, a group in the UK, and a group from Sweden. And really, we had no expectations of what would happen when we started this. But it was really, really clear from the start that a lot of people wanted what we were doing. And so it encouraged people to start their own group. And like I said, we started with three. That was back in September, October. Now we are with 38 groups from all around the world in 20 countries. And they're all working tirelessly to inform people, to reach out to policymakers, to highlight certain aspects of this pandemic. So there's groups that are speaking up for people in high risk groups. There are a lot of groups who are advocating for proper safety measures in schools. And of course, there's the zero COVID groups who have been writing elimination plans, who have been reaching out to those decision makers who could actually implement such a plan. They have been, some of the groups are long COVID groups as well. And they have been advocating for awareness, like recognition of long COVID, for proper research into long COVID and treatment. I
Treatment.
mean, we need treatment. And like, for example, in the UK, it's great that they acknowledged it so early on, but now comes the second part, which is actually figuring out how to help patients, and how to do it in a way that actually benefits patients. And I put it this way because there's a lot of possible treatments that are actually more harmful than that they're in any way helpful. And so there's a lot of work to be done. And I'm so happy to now be able to help these groups along. So of course, the Zero COVID Alliance, we as an organization grew as well. So it started with just me and my partner, who's a colleague from and coronavirus. But now we have partners in Germany, such as yourself, and more people working on this from the US and other parts of the world. So it's really great to see that, this is a worldwide problem. It's a pandemic. It hits everyone. And so we've always felt that the solution should come from everyone.
from
and
everyone and for everyone.
for everyone. Yes,
And I think this is the perfect moment to also reflect on one of the things that you keep on hearing over and over again since the beginning of the pandemic is, why are we paying so much attention to this virus, to this disease? Because there are many other diseases and there are many other problems that all countries or some countries have gone through for decades and years and so on. You always hear, oh, but what about cancer? And what about this? And what about that? But we cannot forget that this is a novel virus and this is an infectious, this is contagious, and it touches things in your body that it should not touch, and it gives you symptoms. We went through a list, right, for COVID and for long COVID, and we need to remember that everything that is bad right now, absolutely everything, from the nice things of not being able to go to movies or a concert or a party, to the things that are more important, like being able to go to school safely or being able to hang out at the office and work and so on. Everything can only get worse unless we deal with this virus, because
exactly. Exactly. I'm so happy you put it that way, because now there seems to be this thought amongst a large part of the population that a lot of the things, a lot of the negative aspects of the last year has been due to the measures instead of virus. And that couldn't be further from the truth. Like, the measures are there to deal with the virus. And yes, in some countries, the measures haven't been
enough.
um, they haven't been enough, or they have some holes in their strategy that make for a situation that even with measures in place, there are still infections that can slip through. And so they feel like, well, we have all these measures and it didn't work, right? I mean, their cases are still at an all-time high, so we can just as well lift everything. um, but the only thing that'll do is prolong this pandemic,
And make it
um,
worse, so not only
and
prolong.
make it worse. Exactly. So yeah, to all those people, I would like to say, we have to deal with the virus, and these measures, the measures should be the correct measures. You have to look at every single way that transmission can happen and deal with that.
Prevent,
If
yeah,
you don't, you will just end up in yo-yo lockdowns like we
like
have
we
been in for over a year. And it's time to get rid of the yo-yo lockdowns, and actually, if um, if it's a lockdown that we're going for, make it a proper one. Make it a one that makes sure that we can get to those low amount of cases, that we can eventually break all those chains of transmissions. That is the only way to eventually be able to open up in a sustainable way, because
exactly.
nobody is actually looking to open up now. Like, if, for example, bars and restaurants, they've been closed for a long time, but if they were to open up now too soon, then the only effect of that will be that they will have to lock down again, and that's what nobody wants. um, so deal with the virus, deal with it properly, so we can get rid of it.
Get rid of it,
Only way out.
and not forget that, like I said earlier, if we don't deal with the virus, everything that is bad can only get worse, which is a terrifying thought for me because it's already bad. I haven't seen my family in over a year. I haven't traveled anywhere, and I used to travel. And I know traveling is not important, but it is important if it's your connection to your family, right?
Mhm.
And there's so many things, easy things, difficult things that we don't do that we want to do. But there's one thing that we should always remember is that this cannot last forever. There's no pandemic in history that has lasted forever, so they do end. the only thing is it depends on us how they end. So how long it will take to end and how bad the ending will be.
Exactly. And just to kind of look into that, I mean, like you said, we now have vaccines, and that's great. And I would like to urge everyone to please get vaccinated when it's your time. Um, but aside from that, the vaccine rollout is very slow. So that means that even if a portion of the population is vaccinated, the others can still get this virus and spread it. And that could cause another wave, like we've seen in some other countries at the moment. Um, and so it's about the timing, right? I mean, we can now all wait for vaccines to provide us that light at the end of the tunnel. But if we actually combine a containment strategy with the vaccines, we have an exit strategy that will help us get back to normal that much faster.
Yeah,
And I don't see a reason why we wouldn't want that.
yeah, exactly. And just to add to that, having a exit strategy that is much faster, that means less suffering, less COVID-19 deaths, and less long COVID.
Exactly. And if I can add to that, less economic damage as well, because that is a major factor for governments to not go for elimination, while in reality we actually see that the countries that have opted for that are much better off economically.
Yeah.
So that's really the only reason why I added here, because I think it is about time that governments open their eyes to that.
Because obviously the economy is important, but a society that is sick and suffering will not
Exactly.
want to shop, will not want to
No.
spend, and cannot spend. And if you add long COVID to the equation, and I keep on talking about long COVID so often because this is part of a series that we're doing on long COVID, it means more economical damage that will take place even after the pandemic is over.
Exactly. And now there's a lot of attention for it. But these patients, they will need treatment for the long term.
Exactly. So it's, I think we've spoken so much about so many things, and there's so much more to say, but I think just for timing reason, I think if two things, I have just one or two more questions that I must ask you. But before we do that, if there's anything else that you would like to add, either from your long COVID journey or your creation of the Zero COVID Alliance, or even the journey of the Netherlands with long COVID or with COVID-19.
Like you say, there's a lot more to talk about. I mean, one of the things that I would like to highlight is what we have been doing with the Zero COVID Alliance, because really having all these groups active in so many countries on so many topics, um, it has been so necessary, and they have booked a lot of wins. So, for example, in the Netherlands, my Dutch group, Containment Nu, we have sued the government for proper safety measures in schools, and to not just get the safety measures, the government was also spreading misinformation. So they said that kids didn't transmit this virus and that they didn't get sick. So we sued them over removing the misinformation from their website, and implement either masks or social distancing, and also to suspend mandatory education. And although we didn't win because it wasn't up to a judge, mandatory education still was suspended because the judge decided to write a separate paragraph to ask for sensitivity towards parents' situation in this pandemic. So that has been a huge win, and it makes for a situation where parents can actually decide for themselves the amount of risk that they're willing to take.
And
So
just to be clear, when you say mandatory education, you're not talking about education per se, but you are saying about in school
in
education.
school
So
education.
online or in school, because obviously education is important, but in a
Mhm.
pandemic, a child should not be forced to go to school when there are so many cases and so on.
Yeah,
So
well, I'd like to put it as a child should not be forced to go to an unsafe school, because it is possible to have safe schools, but for schools to be safe, you need to implement a certain amount of measures.
exactly.
And without that, if a government or a school cannot guarantee a child's safety, it well, parents shouldn't be actually forced to send their kids there. It's just not a right thing to do. So that has been one of the things that we focused on in the Netherlands for a long time. And after we did that, that actually encouraged a lot of safe school groups that are also partners of the Alliance to start the same process. So the same has been happening, for example, in the UK, they're thinking of a lawsuit. In Spain, some of the people have been trying to do the same thing. So that's one of the things that I personally am proud of, and I'm really happy that we could make this change. Another topic that we have been focusing on is initiating research into long COVID, because it is so necessary, and we're just happy to contribute there, both as a patient to kind of help researchers along with figuring out what topics to focus on, as well as finding people that can actually do these studies and helping provide funding for it. So that's one other thing. And we also have, for example, a group in Kenya, and they reached out to us that they simply did not have the means to buy PPE. So we managed to partner them up with an organization that could provide them with proper PPE and with hand sanitizer and so on. So actually, just this morning, we received some photos that they were handing out the PPE that they received, and it's just so great to be able to contribute in this way. I mean, there's a lot of things.
So,
There's a lot to be said for raising awareness, and of course that needs to happen, but these are real issues that need a real response. They need action. And so we're happy to not just provide the not just do the advocacy work, but also be able to help these groups with specific things that they're struggling with. That's what the Alliance is for. Basically, the first question that we ask everyone is, what do you need? Because it's not the same in every country. It's not the same for every person, or for every age group. So, yeah, great things to be working on. And I'm really happy to just be able to work for an organization that has been able to connect so many people from around the world and help each other all on a voluntary basis. It's a beautiful thing to see.
yeah, and it's you're actually seeing it. It's tangible. It's making a difference and being part of that difference and seeing how it helps. And
Exactly, exactly. I mean, there are so many topics that you, for example, like if there's a change needed on other topics, you would maybe sometime sign a petition and you'll never hear from it again. Well, these are actual people that we connect with, that we speak with on a day-to-day basis. And so we go through the highs and lows, both in cases as in mood. And it's not just a partnership. It's these people don't do this because it's their job, but because they feel like they have to. And I feel like that is a major difference in how you connect with people. So I can honestly say that a lot of the groups, they have not just become partners, they've become friends.
yeah, because like you said, it's they feel that they have to, but it's also because they want to, because
Yeah,
all of us, we have the same goal, we have the same dream for this pandemic to just be over, and just for things to get better and just faster for everyone, because
as fast as possible.
it's it's possible, and we need to do it, we need to work together, and we want to.
Exactly. And also that means that our work doesn't stop because like we're worldwide. So that means that now with the vaccines that are being rolled out in some countries see that light at the end of the tunnel, and they are slowly getting back to normal. Where we know that in some other countries that's just not the case. So our work doesn't end in the next half year. Our work will be done once this once we actually make sure that all countries have access to to these vaccines, that there is proper treatment for long COVID, that it is acknowledged in these countries. That's the mission.
It's a mission, it's a lot of work, but it needs to be done, and we want
Mhm.
it to be done. So
I think that's a good note to end on, don't you?
that's, yeah, I just have one more question to
Oh,
wrap the whole thing up, because in the end, this conversation that we've had was a way to introduce you as the founder of Zero COVID Alliance, which is the host, the home of this new series that we're doing, that I've spoken about. And the new series is on long COVID. It's called The Long Haul. And it's a series to raise awareness. So there's acknowledgement that there's this thing called long COVID that exists and can affect us all. And to make others understand that more research is needed and treatment is needed. And also to have that connection to see that's another reason why we cannot let the virus spread. Because if you're letting the virus spread, then you are basically accepting and being okay with having more long COVID patients. And the format of this series is going to be a little bit different than usual. We are going to have two parts of it. One is going to be me interviewing long COVID patients, and Vicky is one of them, and that's why we heard her journey. And one of the things that we have seen with long COVID, that it's very difficult for people that are not part of this club, that we don't that they don't understand it, right? So they don't understand the symptoms, they don't understand how you get it, how you don't get it. And the way we're doing this series is to also interview loved ones, because if maybe people don't understand how disease works or what it entails, but we all have someone that we love that has been sick or is sick. So we all understand that perspective. So we will have episodes that combine the words of the long COVID patients of how they're dealing with this, and also the stories from their loved ones and how they have been living through it. So we'll have a human touch to the series, and we will also have science. I will have a co-host with me. He's a virologist, a scientist from Chicago, and his name is Jeremy Rossman, and he will be interviewing different scientists from around the world, because since it's a pandemic, we obviously also need to understand how is the research going, how what is being done, and see how can we help each other, right? The patients to the research and the research to the patients. And that's what the series is about. And I'm excited, and I think it's needed.
oh, so do I. I'm really excited for this series. I really think it's so necessary to share these stories, and like you say, it's about connecting the right people to each other. We don't want to reinvent the wheel. There is so much research being done around the world now that one of the most important things is to get the research to the right people. And I really hope and I suspect that we will be able to do that through this series.
Yes, I I think so too. Vicky, it has been a pleasure. And with this, my question to you, because your story was a little bit different, because I wanted to know also, as the founder of Zero COVID Alliance, the story of that. But
Mm.
you are our first long COVID story. And just really fast, just to wrap up this interview, one of the questions I will be asking when I speak to family and long COVID patients is if they could give a message to their past selves, or if they could give a message to someone that has long COVID, what is it that they would say?
Hmm.
Message do you want
A
to give?
message to my past self would be very different than a message I would give to a long COVID patient. So I'll opt for the second one.
Mhm.
Pace yourself. That is the one thing that is so important to do. A lot of people go over their own limits and it causes a relapse each and every single time. Um, and the one way to recover is to really take it very slow. And I cannot just I don't just mean this for long COVID patients. I mean this for every COVID patient, because a lot of people have have an initial disease of like 2 weeks, and then they think that they're all better and they go back to normal, and they start to go out for walks again and exercise. And we hear from a lot of people that once they do that, that's when they actually develop these serious long COVID symptoms. So I cannot say for certain because it's just not clear just yet, if the exercise is the thing that causes it, but we do know that it worsens people's symptoms so much. So if you get COVID, please, not just this, a little side note, get yourself an oximeter so that you can keep track of your saturation. It's really important. And once you start to feel a little bit better, still take it slow, at least for another 2 weeks, because that may actually make a change in whether or not you fully recover or not.
Perfect. I mean, very, I don't know what to say. It's difficult to think that you think you're recovered, you want to do what you normally do, go for a run, go for fresh air, and it's that feeling of impatient, of wanting to get back to your normal self, that can actually worsen.
And I say it because I did it myself. And I've had the worst reaction to it. So at the end of June or the beginning of July, I actually had a week where I felt completely better. And I went for a walk. I walked for over an hour, and it caused a relapse of 3 weeks. And the thing is, during the walk, I didn't experience anything. I wasn't tired. I wasn't having any like pain throughout my body. It was like I was back to normal. But then I got home, I sat on the couch, I fell asleep, and I slept through the day. And just thinking back to that day, I don't know how I would be doing if I hadn't done that. And I just want other people to, I want to prevent other people from making that same mistake.
Yeah. Thank you for sharing this, because we haven't really heard that much about this specific thing. So just to close the interview, if you have if you're sick with COVID and you're feeling better, just give yourself a little bit more time. Be good to yourself. and just wait a little bit longer. It might make a difference, like Vicky said.
Exactly.
So, Vicky, it's been a pleasure. Thank you very much. And
Mhm.
yeah, this is it. We start the series,
Welcome to the long haul.
the long haul.